Hello, I'm Dr. Mark Wallace, Chief Clinical Officer for Sunrise Community Health, here to share some important information with you about the Delta strain of the coronavirus now causing the vast majority of cases of COVID around Colorado and across the nation. Compared to the original strain of the SARS-CoV-2 virus, the Delta strain is much more transmissible between people. Studies have shown up to 1,000 times the amount of virus in a person infected with the Delta strain compared to people who were infected with the original alpha strain. We call the amount of virus in your body the viral load. This significantly increased viral load with the Delta strain contributes to easier spread from person to person, especially as few unvaccinated people are wearing masks these days. Some parts of Colorado and many states around the U.S. are experiencing increasing case rates of COVID, with many hospitals and intensive care units filling up with unvaccinated people in their 20s to 40s seriously ill from the Delta strain. Bedside doctors and nurses are reporting faster deterioration of COVID patients, leading to intubation and death that could be prevented by safe and effective vaccines widely available in the United States. We are in a race against the Delta strain and the possibility of other mutations. The more virus that is replicating inside infected persons, the higher the likelihood of more mutations. We need to stop infections from occurring and overwhelming us with a fourth wave. Sadly, many nurses are leaving bedside care exhausted by waves of seriously ill people with COVID requiring intensive care. It is becoming demoralizing for many healthcare workers facing yet another fourth wave of COVID, from folks discounting the seriousness of the infection and the risk of dying when safe and highly effective vaccines are readily available. Remember, deciding you don't want the vaccine shouldn't be based only on one side of the calculation. Some of the conditions you've likely heard about in vaccinated people also occur in unvaccinated people. Some of what you might have heard about the vaccines simply isn't true, like altering a person's DNA. In making your decision, please remember the risk of getting COVID and having a serious outcome or dying is more likely than a serious reaction to COVID vaccine. The risk of serious COVID infection or death from the Delta strain far outweighs the risk from any of the vaccines available in the United States today. Please get vaccinated so that we can end this pandemic and save lives. And I strongly encourage you to get both doses of Pfizer or Moderna if you pick one of these two-dose vaccines. We're learning that the efficacy from the first dose is less effective against the Delta strain than it was against the original strain. However, 2 doses of these vaccines remain highly effective against the Delta strain, as does the single-dose Johnson & Johnson vaccine. Please speak to a healthcare provider about questions you might have about COVID or the vaccines to prevent the disease. Remember, over 600,000 people, including more than 3,000 healthcare workers, have died from COVID in the United States alone. Help us stop any more unnecessary preventable deaths and more families from losing loved ones by getting vaccinated. You can easily access vaccine at 3 of our Sunrise clinics: Loveland Community Health Center, Sunrise Adelante in North Greeley, and Montfort Family Clinic in Evans. Stay well, be healthy, get vaccinated.